RIN TV coverage of the 2015 RIMS conference is brought to you by Inform Applications. According to a recent report published by ACE that looked at the critical risks facing the healthcare industry, hospitals and healthcare organizations face enormous challenges, from new regulatory requirements under the ACA to emerging risks that can disrupt operations. Here at the RIMS conference, we spoke with Caroline Clouser about the report and what it means to healthcare risk managers. She is EVP in the ACE Medical Risk Group and had this to say.
There are several trends in the healthcare industry that have been in the news of late. You've seen emergency preparedness around pandemics such as Ebola. You've seen an increase in hospital violence. And what we're talking to our customers about at ACE is really the effect and impact of data security and privacy. The FBI came out over a year ago and stated that the healthcare industry, although it's a $3 trillion industry, is lax compared to many of the other industries in data security and privacy. And since that time, we've seen a lot of data breaches reported, and that's really been a problem, an emerging risk in the healthcare industry. Right now, we find the greatest exposure faced by hospital risk managers has to do with cyber, really on two fronts. First, there's the cyber breach, which could be the release of confidential patient information, or the cyber hack, which could be hacking into medical equipment, affecting patient care, or hacking into the physician orders, for example. It could also be affecting the communication of an organization, shutting down the elevators, which really could be impacting risk. We see the trend of cyber to change into the future, similar to what we saw with environmental in the mid-'80s. At one time, environmental was sort of a throw-in coverage on general liability forms. We see cyber creating its own marketplace. We see that marketplace growing exponentially into the future, so that our insureds are well protected for their cyber through a comprehensive program, and also really not suffering from the unintended consequence that cyber might bring in the other liability coverages. There are several ways that hospital leadership can mitigate the risk of cyber, and we're working closely with them to develop policies and procedures. It could be following the HIPAA policy and procedures around data privacy. Also, following the AMA encryption standards is really important. And also, it has to do with employee training. Training employees, they're your first line of defense to keep critical information in the facility and make sure that we don't release patient information.
For more of our coverage of the 2015 RIMS conference in New Orleans, visit the RIN TV On Demand Library.